laminitis is one of the most serious and potentially devastating conditions that a horse can face. And yet, it's often misunderstood. In today's video, we're going to discuss what laminitis really is, why it happens, and what you can do to prevent it and spot it early on before it becomes life-threatening. Whether you're a seasoned horse owner or just starting out, this is a must-know topic for every equine caregiver. So what is laminitis? Laminitis is inflammation of the soft connective tissues inside the horse's foot, also called the lamina. These tissues connect the hoof wall to the pedal bone, often called the coffin bone. When these tissues become inflamed, the horse experiences severe pain, lameness, and in extreme case, permanent hoof damage, and sometimes the horse has to be euthanized. Think of the lamina like a bridge. If the horse's hoof is a suspension bridge, think of the lamina as the supporting structures holding it all together. And if the lamina isn't there to keep the pedal bone inside of the hoof implant, then the whole thing falls apart. You will get rotation of the pedal bone. Let's pretend this is the coffin bone or the pedal bone inside the horse's hoof, and this is the hoof wall. So you have lamina in these areas, like between the bone and the hoof wall. And when the lamina becomes inflamed, it detaches, and then you can get the bone, the pedal bone starts to move. It can rotate. It's severe enough it can detach entirely and protrude through the sole of the horse's hoof. Super painful for the horse. If this happens, euthanasia is the humane thing to do. Causes and risk factors. Laminitis isn't caused by one single factor. It's usually a combination of triggers. Common triggers include overconsumption of rich pasture or grain, sudden dietary changes that the horse isn't used to, metabolic disorders such as equine metabolic syndrome or Cushing's disease, excessive weight and obesity, and if the horse has systemic illness or a severe infection. Basically, anything that can trigger the horse's metabolic or circulatory system can trigger laminitis. So you're probably wondering, how does a horse overeating or eating too much of a certain food like rich grass or grain, how does that contribute and potentially cause laminitis? It's a little bit complicated, but I'll simplify it so that's easy to understand. So when a horse eats too much sugar, their glucose spikes. And a lot of horses, especially insulin-resistant horses or overweight horses, they struggle to handle this sudden spike in glucose. So then the body receives a signal to release insulin, which is a hormone responsible for taking the sugar out of the bloodstream and letting it into the cell so they can use it for energy. Now, the more the sugar, the more the insulin. The higher the sugar spike, the more insulin that gets made. Now, high insulin and high sugar vasoconstriction, which is when blood vessels tighten, become smaller, constrict. So as you can imagine, there's less blood supply. There's less blood flow, less blood circulation. And blood carries oxygen and nutrients. This results in the tissues being weakened or damaged. Now, the lamina are very intricate tissues, and because they're so far from the body, their circulation's impeded. You really see the effect. And horses are very heavy animals. They absolutely need to be able to rely on their hoofs to keep them upright. There's a little more to it than that, but in a nutshell, that's essentially how it happens. So how to recognize the early signs of laminitis so that you can take action and prevent it from getting worse. Early recognition is key, so look out for lameness, particularly in the front feet. Now remember, lameness isn't refusing to put weight on a hoof or limping. It can be, but lameness is characterized as discomfort in mobility. So shifting the weight, putting weight on a hoof intermittently, being hesitant to pick up their hoof. These are all indications that your horse is experiencing lameness. I can put a little card up above if you want to learn a little more on how to recognize the lameness in your horse. Back to the video. You might also see a horse that has a sawhorse stance. This means they're shifting weight, this time in their back hooves from one foot to the other. Sawhorse. If you pick up your horse's hoof and they feel warm or they're sensitive, you're picking your horse's hoof, you're just touching the bottom and they're flinching, that means it's painful. If you feel heat coming from the hoof, now, of course, your horse is going to always have a little bit of warmth to your hoof. That's why it's very important that you get familiar with what's normal for your horse. You are presumably picking your horse's feet on a semi-frequent basis, at least every time you ride your horse. Every time you see your horse, you should be checking their hoof. So you're probably familiar with what's normal for your horse, but if you're feeling radiating heat from your horse's hoof, something is amiss, because heat is a byproduct of inflammation. If your horse is reluctant to move, if you notice their strides are shortened, or they're displaying unusual behavior, these are often early signs of laminitis. If you notice these signs, call your vet immediately. Laminitis can progress very quickly, and early intervention is key. Let's talk diagnosis and treatment. So your veterinarian will confirm a diagnosis of laminitis by physically inspecting your horse's hoof, a physical examination of their overall body condition, x-rays to assess hoof rotation. The treatment really depends on the severity. If it's mild, your horse might be on strict stall rest with plenty of bedding. They might require corrective shoeing to help support the hoof as it heals, as those connective tissues, the lamina, heals. They might need their hooves trimmed. Pain management will be key, often an NSAID, which is a non-steroidal anti-inflammatory. There's probably going to be some dietary adjustments, the key factor being focusing on a reduction of sugar. And if there's any underlying metabolic concerns, addressing those causes. So how do you prevent your horse from getting laminitis in the first place? The best way to maintain your horse's current health and keep laminitis at bay is to understand how delicate their digestive system really is, and you can shock it, so to speak, with sudden dietary changes. So if a dietary change is called for, whether it's to control a metabolic issue or maybe the food that you normally feed is out of stock, it's very important that you do a gradual change, usually over the course of 7 to 14 days, depending on how severe the dietary change is. It's also very important that you manage how much grass your horse is eating. I'm in this boat at the moment where the grass is going to be coming through in the spring, and my horse needs to have a grazing muzzle on because she's a chunky girl that already puts her at an elevated risk for laminitis. Remember, their weight is an extra stress, and it impedes circulation after all. Last thing we need is a sugar spike. And she's got a high percentage of body fat, so that means she's not as sensitive to insulin. So her body will produce more insulin, and the rest, inflammation. So keeping your horse at a healthy weight is obviously going to be very advantageous. Make sure you keep up on your horse's hoof care regularly. Sometimes a horse can cause laminitis in one foot if there's an issue with one of their hooves and they're shifting their weight to a certain foot. It puts extra strain on that foot, and that one can founder. Make sure you're keeping up on your vet checks yearly, if not biannually, because again, you can have some sort of muscle strain or joint issue causing the horse to carry its weight in an unbalanced way. And that's another trigger for laminitis. And of course, monitoring your horse for metabolic disease early on. So getting blood work done routinely, doing a body condition score check on your horse to ascertain what their body fat content is like. I can put another flag for that video and another tag for that video if you want to check out that video. So bottom line, laminitis, it's not just a painful, crippling condition for your horse to have. It is life-altering. How you work your horse changes. How you pasture and stall your horse changes. What you feed, activity. So an ounce of prevention really is worth a pound of treatment. But with careful management and awareness, many horses who have suffered from laminitis in the past can go on to live happy, healthy lives. Laminitis may sound scary, and it is, but knowledge is power. By understanding the causes, recognizing early signs, and of course, working closely with your vet, you can prevent your horse from this dangerous condition. If you found this video helpful, consider subscribing and leave a comment. Have you ever dealt with laminitis in your? I'd love to hear your experiences. And if you want a horse feeding guide that takes the guesswork out of dietary changes for your horse, you can grab my no guess horse feeding guide. I'll put a link in the description. I'll see you guys next week. Bye for now.